Welcome everyone to today's HHS Town Hall on Thursday, May 6th. We have an agenda today to get through that includes some new material as well as some familiar updates that we have every week. My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Pleased to be playing a moderating role today for the Town Hall. As is always the case, we will have a Q&A at the end of the presentations today. Throughout the presentations, though, you can pose questions using the Q&A function at the bottom of your screen. Just would ask everyone, please use the Q&A function as opposed to the chat for posing questions. It helps our panelists do look in the Q&A function, and we'll respond to questions as we go throughout the presentations. And as those responses come in, you'll see them kind of accumulate within the answered tab in the Q&A function. So then after our Q&A, we'll also have an opportunity for some celebrations, which are always super important to this particular format. So first up, I'd like to ask our President and CEO, Rob McIsaac, to kick things off and tell us a bit about today's agenda. Rob, over to you.
Oh, thanks very much, Aaron, and welcome everybody to this week's Town Hall. No shortage of updates to share with you today. Last week's provincial modeling suggests that although the number of COVID cases is still high, cases seem to be starting to crest, and our collective efforts, the collective efforts of our community are having an impact. There's also increasing certainty and predictability on the vaccine front, which is great news. As a result, the provincial COVID critical care command table has signaled that it would appear we're likely to avoid the worst case scenario that would require that horrible situation about making decisions about who gets care and who doesn't. However, that said, our system remains under incredible pressure, and ICU occupancy continues to be at historic highs. Over the past several weeks, there has been significant effort across the province to expand critical and acute care to make sure that we have space for everybody who needs it. In order to do that, and in alignment with provincial directives, hospitals across the province, including Hamilton Health Sciences, have deferred surgeries, procedures, and even diagnostic services. This has meant that Ontario-wide, more than 250,000 surgeries and procedures have been deferred. And of course, that number grows every day. We know that clearing this backlog is going to be a very significant challenge. And we are already starting to think about strategies to implement when the time comes for us to do that. For now, hospital leaders and physicians across our region are remaining in constant contact to assess critical and acute care capacity and to do our best to balance the load across Ontario. Our peers in Toronto are continuing to struggle with COVID admissions and caring for the sickest patients. This means that transfers into our region have continued and are likely to continue for some time, the next few weeks in the very least. In addition to our pandemic response, we are of course also working to maintain access to our specialized regional programs for non-COVID patients who may come to us from across the region. This has required discussions with the province about possible reinforcements if the current demand and pressures on our hospital persist. Some other hospitals have already received help from teams that have arrived from out of province, from Newfoundland in particular, and from the Canadian Armed Forces. We will share information with you as it becomes available regarding any developments on this front. Finally, before I hand it back to Aaron and the rest of our panel, I wanted to acknowledge our new speaker, Dr. Dashminder Sedev, one of our emergency department physicians. Earlier this week, I met with Dash and one of his colleagues to learn more about a national COVID vaccine campaign called This Is Our Shot. I was really impressed with all that they've achieved and with their enthusiasm for this campaign. So I'm really pleased that Dash is here today to tell us more about this movement and how we can help to address vaccine hesitancy. So thanks again, everyone, for attending today, and I'll pass it back to Aaron.
Thanks very much, Rob. Next up, we're going to have an operational update from our Chief Operating Officer and Executive Vice President for Clinical Operations, Sharon Pearson. Sharon, where are we at this week?
Great. Thank you very much, Aaron, and good morning, everyone. In the operational update today, I think I can touch on a few areas that Rob's highlighted in his opening remarks. One specific update is around our status as it relates to our surgical and procedural care. Everyone's aware that for several weeks now across the province, hospitals have been ramped down to provide only urgent, time-sensitive care. And we were asked again this week, or rather that message was reinforced to hospitals this week, that we need to maintain that position. And of course, we're all very well aware of the very concerning sequelae of being in this ongoing ramp down position, but at the same time, needing to maintain that COVID capacity that has become so essential in these recent weeks. So we continue to provide regional access to our programs, provide for priority 1s and 2s primarily. And then just a reminder from a children's perspective, the children's hospitals are not included in that recent directive as far as the ramp downs, and that care continues. We do maintain the ongoing census balancing that has been placed now for almost several months, but has really ramped up in the recent weeks and even in this last week. And again, the objective of that is to ensure that not one hospital is overburdened, but also not one region is overburdened. So as I mentioned, we have patients going in every direction in the province, to the east, to the south, to the north, and the west. And primarily, we're seeing our transfers coming in from William Osler primarily, but sometimes other GTA and central areas. And I did provide at the bottom there, you can see the numbers and the increase that we've had in terms of patients coming from out of region. And it has been quite substantive, the volume. So the teams have been working very hard to accommodate the transfers coming in. And HHS, I have to say, has been a great system partner through this. If we go on to the next slide, our planning, we have, as I mentioned in previous weeks, increased our critical care capacity. And it has a substantive increase of 38 beds, so a 43% increase, and those beds are all full currently. We have been asked to plan for further expansion, as Rob mentioned in his opening remarks, and Dominic will update us. We see a glimmer of hope that we may not need that additional capacity, but of course we will ensure everything's in place in case we do. Because we have opened so many additional level 3 beds, we have required the extra staff. So I think it's close to 240 staff now that have been redeployed primarily to our critical care, but not all to our critical care areas, to augment those teams and help care for those patients. So thank you to those staff who are deployed, because I know that it's very disruptive to one's work and personal life when your job place moves, but also to thank the teams that are welcoming them as well. So we do appreciate all the effort that's going into caring for the COVID patients and for the others. We continue to maximize our post-acute capacity and working with the satellite health facility. I mentioned last week there was some change to legislation around ALC, and we're working with home and community care to enact not the legislation, because if you recall, that was about moving patients without consent. We're not doing that, but we are working with partners to expedite discharges to long-term care. And if you go to the next slide, in terms of a sort of a real-time status, we have remaining outbreaks at Juravinski and St. Peter's. Our occupancy as of today is 109 in the ICU. So that reflects those additional 38 beds. And you can see our current COVID numbers. They are down just a little bit. We were peaking just above 100 last week. And again, really no change with our inpatient acute ward occupancy. It's much the same, and again, reflects some of the challenges we have sometimes with the outbreaks. And at this point in time, we have 105 staff and physicians off self-isolating. If we go to the next slide, lastly, just to update on the mobile health unit, I would ask or invite everyone to have a look at the website. You can see more pictures, and there's more detail around the construction of the site as well. I see some interior pictures here, so things are moving on very quickly. We still have our critical path timeline in place that will take us to the end of May before we would see the first patient. Sunnybrook do have patients in their MHU, as I mentioned last week, and we continue to work with our regional partners around how we would actually mobilize the staffing for the unit, keeping in mind it would be a provincial and a regional resource that we would be supporting. And if with that, I will hand it back to Aaron, and happy to take questions later.
Thanks very much, Sharon. Next up, we're going to have an update on the epidemiology of the pandemic, locally, provincially, nationally, as always, with Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control. So Dominic, take us through, where do we sit this week?
Yeah, thanks, Aaron. On this slide, you see the status from last week. And when you look at the upper left corner, Canada was sitting at 147. And when we go to the current week on the next slide, you see we moved down slightly to 145, so no significant difference. And the reason for that is that while we see a reduction in many of the provinces, as you can see, including Ontario as well as Quebec very significantly, we see a steep increase, as you're probably aware, in particular in Alberta. Nunavut is struggling as well, but in case of numbers, given the small population, you're looking at 5 to 10 cases per day. So also that looks like a lot here with 160. It's relatively small case numbers compared to what we see typically in Ontario in the range of 3,000 plus these days. Another province that's struggling more than ever is Nova Scotia. As you can see, first time ever, I believe, higher numbers than Quebec, and they continue to increase, it seems. On the left-hand side, I added the figure that shows you the trend over time, where you see as a nation we did have peaked. However, we see another increase now, mostly driven by Alberta. Next slide. This is our epi curve in Ontario. We have had our peak a couple of weeks ago. Number of cases continue to decrease quite slowly, though. Probably sitting this week where this black bar is, so below peak of the second wave, but certainly still quite high numbers. Next slide. This change now in terms of number of new cases starts to have an impact on hospital admissions, where we peaked 2 weeks ago. And at the provincial level, number of ICU admissions have plateaued as at the high level, close to the 900. Haven't decreased yet significantly, but at least no further increase. So some good news from that perspective. Next slide. These are the numbers, the models from April 1st, and you know that's the one I said that was overly optimistic. Probably what happened was underestimating the effect of the Easter weekend, and after that we more or less followed the in terms of trends the green and yellow line. Then 2 weeks later on the next slide, the model from April. Next slide, please. From April 16, where we're actually doing better than expected. And last week on the next slide, the newest models that came out, we seem to align more or less with the middle option of the 3 scenarios that they offered, doing slightly better than that, with case numbers decreasing a little bit faster than what would have been expected in that moderate reduction transmission model that they offered. Next slide. ICU-wise, again, here, the April 16 model, which was very concerning, as you all know, with expected far more than 1,000 patients in the ICU. As mentioned, we plateaued just below 900 at this point. On the next slide, you see the updated from last week, April 29th, and again, being pretty much where expected or maybe slightly better compared to that model. Next slide. The Hamilton view doesn't look as optimistic, I would say, unfortunately, as the provincial one, but there's been issues with data reporting and going into the system. So that may have screwed up some of the data over the last 7+ days. And I understand that those problems have been solved. So we can now again rely on the data. So while it looked like we declined much faster, maybe the truth was that we didn't decline that much faster. Now the question will be, are we plateauing below peak at this point, or will we see that the trend of slowly going down will start to kick in as well over the next few days? Next slide. Local hospital admissions here in Hamilton, you also see a reduction in overall numbers of COVID patients in the hospital. The big red columns here. ICU more or less stabilized, but still slightly higher than the week prior. Number of intubation patients still continues to increase. So we haven't plateaued yet as much locally as the province as a whole has. Next slide. What do we see in terms of mobility? And as you know, this is being used as a proxy of the number of interactions people have, and as such, the number of the level of risk that you have in the population. You see with the stay-at-home order, we had a reduction, not as much of a reduction as we had back in beginning of January, where you see that drop to roughly -30% mobility compared to the baseline prior to the pandemic, which was still more than the -45% max that was achieved during the very first lockdown in wave 1. This time we are at -25%, and over the last week, mobility has steadily increased again, maybe a reflection of the pandemic fatigue that probably pretty much everyone has at this point. Next slide. These are the models taking, the local models taking those changes in mobility into account as well. The most plausible scenario is the gray line that you see here. You see a relatively steep decrease similarly to wave 2 until end of May, when we expect that the stay-at-home order will be released. And then the decline continues at a less steep rate, I would say. And you see the green and the purple dotted line, which gives you an idea of the level of uncertainty. So we expect that we fall somewhere in between those two lines over time. Based on this model, we will be at roughly 10 new cases per 100,000 by the end of June, which is still more than we would have had between the second and third wave. Next slide. The main population, as you're probably well aware, are the 20 to 59-year-olds, highlighted here with that red circle, which shows the certainly the highest peak and the longest peak, or the longest time period that it takes for those case numbers to come down. The scale is different in those 4 age groups that you see here at the bottom. So for this age group, it goes up to 120. In the 80 plus, it only goes up to 220. But what you clearly see that compared to what we've seen in the second wave in the 80 plus age group, we hardly see anything happening currently in the 80 plus age group. And obviously that's the effect of the vaccine. Next slide. Talking about vaccines, that's a report Public Health Ontario pushed out yesterday, looking at the vaccine effect, a relatively superficial look at it. But what you can see is in the first 13 days before, after the first shot of a vaccine, you see that we had roughly 350 cases in those vaccinated occurring per day. And then you see that drop starting at day 10 post-vaccine. Then you have a continuing slow decrease from day 14 to 28. And it looks like probably after that, those 4 weeks, you have achieved your sort of maximal protection from the first dose, because then the decrease sort of leveling off. Important to say that the majority of infections after the first dose occurred within those 14 days. So that's the yellow bars here, which is a time period during which we don't expect a major protection from the vaccine yet, because your immune system first needs to mount immunity. And the vaccinated individuals were only responsible for 0.06% of all people who had a positive test were vaccinated. So reassuring data in terms of that a single dose has a very high impact, in particular at the population level. On the next slide, I'm showing you the sort of the breakthrough. This is mortality, and you see there's one death in the 40 to 49-year-old with COVID in a partially vaccinated person. The vast majority of the deaths after one dose occurred, as you would expect, in the 80+ population. No breakthrough death in the fully vaccinated yet, but you also need to take into consideration that there's many more people out there that have had a single vaccine than have had the 2 shots. In the third column, so to say, you see the number of deaths in unvaccinated individuals as a comparison. Next slide. Talking about deaths, I showed you this previously, and it hasn't changed significantly since. So in total, we have seen 366 deaths in Hamilton with COVID. At sort of the peak of the second wave, we have had roughly 1 death per day. The average over the last few weeks, despite the higher number of cases, is at 1.3 deaths per day. Again, because the highest risk population has been vaccinated at this point. And on the final slide that I'm showing you, I just added here the cases by age group. And when you're looking at the like the turquoise color here, this shows you the number of active cases currently, and the vast majority are in the 20 to 29-year-olds, and then falling down more and more the older the people get. And then when you're looking at the dark blue bars, that shows you the number of deaths. And as you know, the vast majority being in the 80+, then a much smaller number in the 70 to 79 range, a few in the 60 to 69 range. There were the occasional other deaths that you don't see because it's only a few, but in the other age categories as well. But that pretty much explains this difference. Also, we have many more cases in the third wave. We see much less deaths because we have that shift in the population from the elderly to younger populations that are responsible for the vast majority of all active cases at this point. Thank you very much. Handing back to Aaron.
Thanks very much, Dr. Mertz. Next up, we have an update on our vaccination process and progress locally. And our Vice President of Women's and Children's Health, Bruce Squires, is on deck to give us that update. So Bruce, where do things sit this week?
Thanks very much, Aaron. Always a pleasure to be able to update on this strategy. I'm particularly excited this week to hear from our next speaker. So I'm going to try and go as quickly as I can, but I will highlight that last week we signaled a level of cautious optimism as it related to the vaccination program in Ontario and in the city of Hamilton. And I think that I think that's borne some truth over the course of the last week. And so I want to just describe a little bit of that. The first piece is really the announcements that the province has made around eligibility for vaccination. And I'll walk you through this table with a little bit of the detail, but it's at its highest level, the key message is that essentially the province is opening up eligibility for vaccination to everyone over the age of 18 by the week of May 24th. It won't be on the 24th. It'll be someday that week, but there's a commitment to open up eligibility, as I said, for all adults. Little sidebar here, the province is expected to announce fairly soon the strategy as it relates to those under the age of 18. Folks will have heard on this week that the Pfizer vaccine has been approved for ages 12 up to 15. It was already approved for 16 and 17. And so that, along with other data, has been looked at very closely by a pediatric vaccination table that includes our own Jeff Pernica, who have provided advice to the government. And so we're expecting them to act on that soon and to give details. So as soon as that's ready, obviously we'll put it out. So we're getting to age 18 plus by really progressing fairly aggressively over the next 4 weeks to add age bands. And so effective this morning, anyone 50 plus could book through the provincial booking tool to receive a vaccine, and we'll move in 10-year age bands over, again, the course of the following 3 weeks. There continues to be a focus of the strategy in the province around hotspots, those areas where there's high impact in terms of morbidity and mortality on the population, geographic areas where there is low coverage, where there are particularly vulnerable populations. And so as you'll see across the top, at least for the next couple of weeks, there's a strategy to allocate a fair amount of the supply of vaccine to targeted hotspots. And so in line with that, you can see that effective, again, this morning, anyone over the age of 18 who lives in one of these hotspots is eligible to book. And that includes 5 postal code areas here in Hamilton. Health conditions, we've talked a lot about this over our previous weeks. And again, effective this morning, we've moved into the high-risk health conditions. And that includes, in addition to those we previously described, individuals with a BMI over 40, individuals in active chemotherapy treatment, and individuals with an intellectual or developmental disability. Again, we're not at the place yet where the pediatric population is being vaccinated there, but caregivers, pediatrics or otherwise, again, are eligible to book through the provincial booking system online or on the phone as of this morning. And next week, not sure which date, but at some point next week, we'll move to the at-risk health condition, which is a much larger list. The last group is cannot work from home. And effective this morning, really, we've moved to a much larger group eligible, primarily education workers. So the rest of the education sector included in group 1. And then others in the cannot work from home will be added in the week of May 10th. And so again, when you combine that with really the entire province over the age of 18 being eligible by the week of May 24th, you can tell we're getting a long way in terms of our strategy. Next slide, please. So I've been talking about initially about eligibility. Well, obviously that's one part of the equation. The other part is actually having the appointments and the vaccine supply available. How far have we gotten? Well, over 5.5 million doses in Ontario. In Hamilton, we are over 200,000. That takes us to 37% of the population. in my mind, the really good news is it took us more than 4 months to get to 200,000 doses. We will have more than 200,000 doses over the next 8 weeks. So by June 24th, we will have an additional 200,000 doses. So you can see us doubling our coverage in a very short order. That's big, big growth in primarily Pfizer, but also some with Moderna, some with AstraZeneca, and potentially some with the single dose Johnson & Johnson. So what else to add real quickly? In terms of Hamilton, we also continue to have a mechanism in pharmacies and in some primary care clinics to right now provide individuals over the age of 40. So again, that's a little bit of ahead of who's eligible to book provincially with the AstraZeneca vaccine. And so that continues to be available. Again, I'll point out the 18 plus in our hotspots can be through the mass and through mobile clinics. So everything else I've already covered on this slide. We go to the next slide if we can. So this was highlighting around individuals with health conditions. We've now moved to high risk as of this morning, and they are eligible to book through the provincial vaccination system. We have really targeted communications that have been developed that can be used by each of our services to reach their populations to advise. And so we're going to be further rolling that out today and over the next few days. And again, you know, the key message is that the individuals and their caregivers can book directly through the provincial tools. Last slide. You know, this, and I think this is a good segue to our next speaker. So HHS staff. Well, first of all, on the dose interval, Dr. Mertz has spoken to the data on the effectiveness of the first dose. To date, the province continues with the direction they've given on second dose interval. However, we do know with such increasing supply that there at least seems the possibility that we may see an ability sometime in the future to have our second doses move forward. But to date, that does not exist. And so we must continue to follow the provincial dose on our direction on second doses. In terms of our teams, if you want to, and we encourage you to book your vaccine, as of this morning, you can do it directly on the provincial system. All you need to do is attest that you are a healthcare worker, and that will allow you to self-schedule a vaccine really anywhere that an appointment is available. So really, you know, it's very easy now to take advantage of the opportunity for vaccination. Encourage all of us to do that. And as I said, Aaron, I think maybe that's a good transition point for me to send it back to you for our next speaker.
Awesome. Thanks, Bruce. And as a communications person, thank you for thinking of the transition. Next up, we have Dr. Deshminder Singh Sadev, who is with us. He's a trauma and emergency medicine physician at Hamilton Health Sciences, and he's also been deeply involved in the This Is Our Shot movement, encouraging reducing vaccine hesitancy and encouraging people to get the vaccine. So Deshminder, what do we need to know?
So thanks for having us on today, guys. This Is Our Shot movement kind of grew out of a number of different groups that were trying to address specific problems with regards to pandemic messaging, access to care, access to testing, even within specific cultural communities across the country. And as those problems kind of got ironed out, we realized the next great frontier here is vaccine hesitancy. So we were kind of all addressing these issues individually on our own. So the Somali community speaking to Somali citizens, Punjabi community using information coming from Punjabi task force members, Italians, Jewish members, so on and so forth. Although we each had to adapt our messaging and our mechanism to deliver that, we found that a lot of the questions around vaccines and hesitancy were really the same, even whether you were a new Canadian or had been here for generations. So really, this is not really unique questions, but they were prevalent. So what we want to do is we want to help Canadians make a good choice, an informed choice, and feel really confident about getting a vaccine. Now we're at a spot where we're in the third wave. It's been mucky. We've got new variants that we really didn't know how to anticipate early on in the pandemic. We're full with our critical care capacity, and widely accepted that vaccination is really the key strategy to get us back to where we were before, to get us kind of back to some degree of normalcy. So we've had supply issues along the way. These have been really frustrating, and overall, it seems the public is understanding that we're on a good track now, and we're gonna have enough to get everybody a shot that wants a shot. That being said, access is not going to be the only thing that ensures we get to herd immunity. So vaccine hesitancy is a real problem. Recent Angus Reid poll, about a third of Canadians were hesitant or resistant to the idea of vaccination. Throughout this pandemic, people have been hearing about what they can't do. You can't see your friends, you can't see your family, you can't go out for dinner, surgical teams can't operate. We wanted to take that kind of limitation mindset and flip it around to something that people can actually get involved with, be a part of, something that's empowering. Next slide, please. So the solution that we came forward with all these culturally centric task forces across the country was the This Is Our Shot national vaccine campaign. And you might have seen this already on social media. We've been featured in traditional media as well. What we're a group of grassroots organizations. We're coming together towards a common goal for Canadians. We want to bring people together, have them informed, have them access information that they can understand. On our website, www.thisisourshot.ca, we've got information available in about 30 languages that's specific to vaccines. On top of that, we've been doing a number of small town halls, reaching out to specific groups. For example, 2 weeks ago, myself and a couple of other colleagues did a town hall event for youth that are involved in the shelter system. So trying to specifically address their concerns. We've had larger town halls. On the 28th of April, we had a national town hall event with Isaac Bogosh and a couple of other very prominent physicians taking calls and questions from across the country, as well as a couple of celebrity questions like from Perdita Felician, for example. These, some of these questions are common questions that we're all probably bored of hearing, and some of them were pretty eye-opening, and really the best way to get down to what's bothering people is to ask them, and that one part has been really surprising for me. So we've got the information side going. Now the other part is getting people excited about it, and what we're going to do is we're going to use the FOMO principle, the fear of missing out, to get people excited about participating. So far we've had hundreds of influencers from all domains, prominent Canadians get involved, a lot of the time without us even asking them to participate. What they're doing is they're putting on a shirt, they're making a short social media message, putting it out there, and encouraging people to either get vaccinated or highlight their own reasons for feeling that this is an important thing to do. So these are famous people. We're giving away t-shirts to them so they can participate. Now here's the thing, everyone can participate. If you go onto the website, you can buy a t-shirt. All proceeds from t-shirt sales go to Kids Help Phone. And that's kind of important. Children's mental health is really the unrealized next dilemma that we're going to face, I think, coming out of this pandemic. And Kids Help Phone throughout this last year, they've just been overwhelmed. They're seeing double the call volumes they usually do. They don't have enough staff, enough lines, enough resources in general to deal with what they need to deal with to address all the demands for help. So by getting people informed, by getting people excited, we want to take vaccine hesitancy and turn it into vaccine confidence. Next, please. So who do we got? Well, I'm flat out humbled and overwhelmed by the support that we've seen from corporate Canada. So Bell Media, Rogers, Enbridge, Rexall, Amazon, Facebook, big time players are coming forward, not only allowing us access to their infrastructure and human resources, but opening up their pockets. Amazon just bought 10,000 shirts. They're going to distribute some to their staff, some to frontline workers. They're going to be donating some shirts as well. And again, it's a notion to be involved in something positive, something that you feel you can do. People in entertainment, Ryan Reynolds has been a huge advocate for us. Every day he's putting out some messaging. Bublé got Justin Trudeau involved. We've got athletes, particularly Haley Wickenheiser and Clara Hughes, who were involved with our last town hall event. They've been tremendous advocates. They've been doing some traditional media as well, some fantastic, very emotional interviews on how they finally feel like they're empowered to do something rather than being told not to do things as they have been throughout the entire pandemic so far. Chris Hadfield, Roberta Bondar, just incredible. The list goes on. Healthcare institutions have really stepped forward too. So Peel Public Health was one of our first sign-ons in that sense. We've been working with Peel Public Health as our prior incarnation, the South Asian COVID Task Force, helping them get public health messaging out to cultural groups and communities that might have been missed through mainstream communications that really are mostly targeted to middle-class Canadians that have disposable incomes. Well, guess what? Other people are getting infected and other people need to be protected. So that's the kind of the gap that these cultural-centric groups tried to fill. Unity Health, St. Mike's Women's College, these guys are all participating. They're buying shirts. They're setting up selfie stations, and it's kind of self-evident to them how this, on the one hand, is helping with morale within their own institutions, and on the other hand, it's addressing a real problem. So when it's not just about getting shirts on people and raising some money for Kids Health Fund, it's putting the website out there. People can go onto something reputable, read about vaccines in a language that they feel comfortable with, and reach out to set up a town hall event if they feel they need to. Coming up in May, we've got another national town hall event. We're going to use a couple of our own experts from HHS in that context. And then finally, when we wrap up the campaign in early June, we'll have one more probably televised town hall event with our media partners. And hopefully that'll roll in nicely into summer, where we're going to have really, really wide availability of vaccines. But it's been said before, vaccines don't save people, vaccinations do. And to get there, accessibility is one part, but addressing people's concerns in a respectful way is not only important, but that's who we are as Canadians. That's how we do things. Next, please. So I've kind of talked about this before already, but as an individual, you can go on the website, you can get a shirt, make a social media message about it. I don't care if you have 5 followers or 5 million, put it out there. Even if you're prompting one individual to go and get some more information, to maybe address the concerns that they have, that's going to be helpful. The institutions can buy shirts, share with employees, buy shirts, donate them to other smaller institutions. At HHS, speaking with our leadership earlier in the week, we talked about maybe having participation within the acute care settings, the COVID wards. What's it going to do? It's going to help morale, and kind of innately, healthcare workers are excellent ambassadors for this problem. Even though we should acknowledge vaccine hesitancy is an issue within our own ranks, and that's not something we should approach with remorse or with malice. It's an opportunity for us to talk to our colleagues, address the issues that they have, and hopefully get them to a point where they feel that vaccination is the right choice for them as well. Next, please. So this is what it looks like. I don't know, maybe it looks better over there than it does on me. Definitely looks better on Ryan Reynolds. We've got, this is a shot logo on the front. On the side, you can see it says "Get your shot" with a little mock Band-Aid. Now the cool part about this shirt is that that's available in 28 different languages. So get your shot in English, get your vacuna in Spanish, get your tika in Punjabi or Hindi, and on and on and on. Of course, we've got French versions available. We can make modifications to this for institutional orders, as we have for Peel and for St. Mike's. Next, please. So these are some of the guys that are involved. Bublé, Ryan Reynolds, again, tremendous advocates, but to be honest, I don't know what the hell else they're doing right now with their time, so they might as well do something constructive. But they, you know, they see the value to this, and it's not just a matter of them, you know, putting on a shirt, being a pretty face. Really, these guys are invested because they recognize, you know, as Canadians, each of us have a role in getting us back to normalcy. That's why the social media aspect is so powerful. Not only does it target the next great demographic, as we were hearing earlier, the younger adult population is carrying the bulk of infections right now. It's also a way for people to be involved, to be empowered. So we can't just ignore the concerns of our fellow citizens. That's why we have this information available on our site in multiple languages, and why we're trying to engage a broader public in town hall events. People need something to look forward to. And as silly as it sounds, t-shirts, celebrity involvement, fear of missing out helps make it exciting, helps give people that little push, that little motivation. Ultimately, in the end, what we're trying to do, we're trying to aim Canadians, all our fellow citizens, around getting vaccinated, and take whatever vaccine hesitancy exists and turn that into vaccine confidence. Thank you.
Wonderful. Thanks very much, Dr. Sadev, for being part of the town hall today and sharing that. I wonder what size Ryan Reynolds got. I think I might have to get that size for me. Maybe, I don't know. We'll see. But you can see Dash's shirt. You can order those online. If you haven't checked out This Is Our Shot website, I'd really encourage you to do so. I know there's a couple of questions in the Q&A about outreach to other cultural groups, other languages. They have resources available there, exceptionally well organized and available in dozens of languages. So something you can direct people to, and I think also maybe answer some questions that you might have as well on your own. So wonderful, wonderful stuff. So we do have time now for our Q&A session. I wanted to start maybe with you, Dr. Mertz. I know in the Q&A inbox, there was a couple of questions you responded to in writing, but thought the broader audience might benefit from hearing from you about the notion of a fourth wave. And like in particular, does it necessarily follow that we need to continue the lockdown to prevent a fourth wave? Like, what should public policy makers be taking into consideration?
So I think the piece, and we've learned and see that how it, or what happens if we do it right with Israel and the UK at this point. They came out of the wave and nothing has happened despite all the reopening so far. So as long as you do the reopening sort of in step with what you achieve with your vaccinations, nothing should happen. The question is to find that right balance, right? And that's a challenge, and that's an ongoing discussion at multiple levels that currently happens. And what also plays into that is the fatigue that's out there in terms of how much do we achieve with a stay-at-home order if we extended it by another month, when we already now see that the fatigue is going to kick in. So there's the policy piece, there's the real-world piece. Bottom line is just get vaccinated, right? The one thing that gets us out of this, prevents a fourth wave from happening, is the vaccine. I saw the one comment or questions about a fourth wave next winter. Quite frankly, I think we cannot predict what's going to happen in fall or winter, because this will heavily be impacted by how well does our vaccine uptake look like in our population. What will the VOCs be doing? Will we have a significant amount or spread of clearly immune escaping variants of concerns by then? At this point of time, we wouldn't expect the fourth wave. The UK changed their models recently as well. They first predicted the fourth wave in summer. They now say, no, it's not going to happen, not under the current assumptions, but nobody can predict really what's going to happen over the next few months beyond what we know right now. Based on what we know right now, if we do this right, there won't be a fourth wave.
Good stuff. I do know we do have a couple of hands up in the attendees forum. So as always, you can raise your hand in the participants forum and ask a question live. Sometimes people do it in air. So I'm just going to call out Leoris and Jennifer Whitecross have their hand up. So I'm going to ask one more question, then I'll come back to you if your hand's still up, just in case you didn't have a question per se, which happens on occasion. But if you do, we'll come to you in a moment. Dr. Mert and maybe Bruce Squires, one of the topics in media this week has been around the notion of vaccine second shot. I noticed the question come up a couple of times in our Q&A. Can you sub in a different vaccine when you've received, like if you got your first shot AstraZeneca, could you get one of the mRNA vaccines as your second shot, et cetera? Like, where do we sit in terms relative to supply we have? Is that something that's being considered? Is it medically efficacious? What can you tell us?
Well, I think first and foremost, there's a clinical nature to that. So I'll certainly pass it over to Dominic to ask if he'd comment on that. But from kind of a provincial policy perspective, at this point, they have not moved to any substitution as it relates to first to second doses as part of our strategy. But of course, the strategy continues to be guided by the science as it advances, and then by the advice of groups like the NACI and the provincial vaccination table. So I don't know, Dominic, if you've got any comment on that, the science.
Yeah, as Bruce said, I think that's the policy piece that will be at least influenced by the science piece. And the science piece right now shows that there might be a theoretical benefit actually for mixing certain vaccines. Do we have great evidence at this point, clinical experience? The answer is no, right? And then the question becomes, how do you balance those potential experimental benefits versus what would you expect in the population to see? And then what's also going to play into that decision most likely is, how does the supply look like for AstraZeneca versus Pfizer versus Moderna? At this point of time, the recommendation is you go with the same vaccine for your second dose as first dose, because that's how the clinical studies have been conducted. That's where we have strong data, but it may change over time based on what we learn. Maybe sooner, maybe later, we have to wait for that. But right now, it's still same vaccine for your second shot as you received for your first shot.
Thanks very much. Okay, so I note Leoris, he or she still has their hand up. So I'm going to hit the button that would send you a prompt to unmute, and then you can ask your question. So you'll have to unmute. You should receive that prompt, and you can go ahead. Are you there, Leoris? Okay, that's not coming through, so we'll skip that. I want to leave time for some celebrations. I do want to point out today, I think we had a high watermark of 31 questions answered in the Q&A tab. So our panelists have been diligently typing answers. If you do have a moment, I'd encourage you to take a look at those. There might have been something asked that you were interested in, and there's an answer there for you to review. I know there's questions still left on the board as well. So as always, we'll do our very best to get an answer to people that pose those questions. Leoris, if you had one that you didn't get to ask, you can always send it to the HHS news at hhsc.ca inbox that was on the screen a moment ago, and we'll make sure to get you a response. So now we have a moment for some celebrations. The method is you can type them in the chat forum, and either, I don't know, Rob, if you're available, you could join me, either Rob or I can read those out. You could also raise your hand and we'll call on you to give your shout out live. Our panelists are invited, and so are our attendees. So that's the format. Sharon, I see you come on camera. Did you have something you'd like to share?
Thanks, Aaron. I did want to acknowledge the work of Critical, and not everyone may know, but HHS, we host the Critical infrastructure for the province. So these are the group of individuals that support access to critical care resources across the province and then find the beds. And they have been, of course, unusually busy through this COVID period and have done phenomenal work with the province to put in new processes to expedite discharges and transfers across all of Ontario. So I just wanted to shout out to a very small group that's doing the work of an army via Critical. So just to acknowledge them. Thanks, Aaron.
Yeah, great. Thank you so much. So again, anyone can type something into the chat forum, or you can raise your hand as a participant or as a panelist, and we'll call on you to give your shout out. Might be a quiet day today, Rob. You know, we've had some days with many. We've had some days with very few.
Yeah, that's very true, Aaron.
Okay, well, I'm not seeing a ton coming in, so I'm going to suggest we give people the, oh, I see Leslie Gillies. Why don't you take us out?
Thanks, Aaron. I obviously, huge accolades to the staff that have been deployed to both the ward and the critical care areas, but also sincere gratitude to all the receiving staff, the teams that have welcomed our deployed staff members to their areas. We've had some really positive feedback and sincere appreciation from those folks who left their home units to help. So just wanted to acknowledge that. Thanks.
Awesome.
Aaron, I see a couple of shout outs in respect of Nurses Week, Happy Nurses Day. Of course, nurses play such an integral role. We couldn't have a hospital without our excellent nurses who play so many different roles within the hospital. So yeah, great shout out there.
Nice stuff. I see in here as well a shout out to the West Lincoln Memorial Hospital DI team who just went live with ARIS last week from Kevin Marley. Thanks, Kevin. As well, a thank you from Deb Bedini to all the perfusionists at HHS for the work they do with cardiac surgical program and recently with our COVID patients. And it's Perfusion Week, so happy Perfusion Week.
Another shout out to our resilience and employee mental health workers who go between sites and support everyone individually and entire units. They are helping keep us afloat, absolutely.
Oh boy, see, they're coming in now, fast and furious. Thanks from Dr. Ellen Littman to the This Is Our Shot group for their support of Kids Help Phone. Great stuff. I know Ellen asked about where she could get a shirt, and it's online, so I expect to see her wearing one around.
So on there, Aaron, to the PR team who worked on the Medical Heroes series leading up to celebration of International Clinical Trials Day, and a shout out to the researchers and their patients who make carrying out clinical trials possible. Great, very appropriate shout out for our research hospital.
And some additional professional recognition days, as you already mentioned, Rob. Next week is Nurses Week. We'll have more during our town hall next week. Happy Physio and Speech and Hearing Month, International Day of the Midwife, which was yesterday, May 5th, and PSW, or Personal Support Worker Day, May 19th, as well as Doctor's Day, which we recognized last week and was on May 1st. So I'm going to suggest we're almost at time, Rob. I'm going to give you final remarks and we'll take it home.
Yeah, thanks, Aaron, and thanks everybody for attending today. So, we continue to be in the thick of this, but there's some really hopeful signs. I think we just need to hang in there for a few more weeks, and hopefully we'll start to see the fruits of all of the hard work we've been putting in. And we'll get on the downside of that curve, and it'll continue to go down. So thanks all for attending. Thanks to our panelists. A special thanks to Dr. Dash, who I thought gave a great presentation today, and who's doing really wonderful work around trying to overcome this issue of vaccine hesitancy and encouraging people to get that this is our shot. So thanks all, and I hope you have a great rest of the week.